The use of automatic stapling devices has become commonplace in the closure of surgical incisions and wounds due to the increased ease, speed, and equivalent cosmetic outcomes compared with traditional suturing. Consequently, the removal of wound staples, which is a relatively simple procedure that's performed in a clinic or community setting, is something that medical students, junior doctors, and nurses should be comfortable carrying out. And at the end of this video, that's exactly how you should feel. If you've not yet watched the video on how to perform wound stapling, then I definitely recommend that you watch that one as well. The specific postoperative timing for the removal of wound clips is very much dependent on the anatomical location. And you can see the most common locations and their respective timings shown in this table. It's important that wound clips are not removed too early, as this may lead to wound dehiscence, and vice versa, so leaving clips in for too long a period should also be avoided, as it can lead to permanent skin marking and poor cosmetic results. In terms of the equipment required to remove skin clips, we need a special staple remover, which is a jawed instrument and enables the quick and simple removal of the staples. The other equipment we need is a wound care pack, a sharps disposal bin to place the removed staples, some gloves, and in some instances, a wound dressing which we can apply over the wound after the procedure. But this is typically not necessary. The process of removing skin staples is pain-free, and typically, patients should tolerate it well, without the need for any analgesia. After ensuring the patient is in a comfortable position, and washing our hands and putting on our gloves, we can then start to remove the staples. We do this by placing the lower jaw of the staple removal instrument underneath the crossbar of the staple, between it and the skin surface. As we then squeeze the handle of the staple remover, this lowers the upper jaw, compresses the crossbar, and bends the staple outwards, thus releasing the arms of the staple from within the skin. We can then place the removed staple safely into the sharps disposal bin. The process is then repeated for the rest of the staples in the same manner, until all of the staples have been successfully removed. If you're unsure as to the strength of the wound at the time of removal, we may choose to only remove alternative staples, or even support the wound by using adhesive surgical tape. But this is a clinical decision that becomes easier with experience.